Welcome to today's eye-opening health alert, especially for those of us over 60. You might feel generally healthy, maybe a little tired now and then, or chalk up your digestion issues to getting older. But what if those subtle signs are actually a red flag from one of the most essential organs in your body, your liver? Today, we're diving deep into 6 warning signs that your liver may be in serious trouble. These aren't just harmless symptoms, they can be life-threatening if ignored. So, if you care about your health, or you're caring for someone in their later years, this is the video you simply can't afford to skip. Let's uncover what your body might be trying to tell you, before it's too late. Fatigue and weakness. Why liver damage steals your energy. Feeling unusually tired even after a full night's sleep might seem like a normal part of aging, but it can also be one of the earliest, and most overlooked, signs of liver damage. When your liver is functioning well, it plays a critical role in converting nutrients into usable energy, detoxifying your blood, and helping regulate glucose levels. But when liver cells become inflamed or start to deteriorate, your body's energy production drops dramatically. Instead of efficiently fueling your muscles and brain, the liver becomes sluggish, like an engine clogged with debris. This slowdown forces your body to work harder for the same output, leaving you feeling drained, mentally foggy, and weak, often for no obvious reason. Studies show that chronic liver disease can cause systemic fatigue, which is not resolved by rest and often worsens over time. This isn't just general tiredness, it's a deep, bone-heavy exhaustion that can interfere with daily living. Seniors are particularly vulnerable because they often have multiple medications, underlying conditions, or nutritional deficiencies that can mask or amplify the symptoms. And here's where it gets dangerous. Most people don't connect fatigue with liver issues until more serious signs appear. The liver doesn't complain loudly, it whispers. But that whisper can grow into a shout if ignored. According to the American Liver Foundation, persistent fatigue, especially when accompanied by other subtle symptoms, is a red flag that should never be brushed aside. If you find yourself napping more, struggling to concentrate, or feeling like you just can't get through the day, it's time to pay attention. This type of fatigue may also be linked to a buildup of toxins in your system that the liver can no longer filter effectively. When toxins circulate in the blood, they affect not just your energy levels but also your brain function, what some call hepatic brain fog. Left unchecked, this condition can develop into hepatic encephalopathy, a serious and potentially irreversible cognitive decline. On top of that, your muscles may start to weaken as protein metabolism slows down, which contributes to frailty and falls in older adults. Even mild liver inflammation, like that caused by non-alcoholic fatty liver disease, NAFLD, which is extremely common in seniors, can cause persistent fatigue long before other liver tests show abnormalities. This is why doctors are increasingly recommending liver enzyme screenings for seniors showing ongoing fatigue without a clear cause. There's also a link between the liver and anemia, a condition that saps your energy and is often mistakenly attributed to age. If your liver isn't processing iron and storing nutrients properly, your blood doesn't get the oxygen it needs, and that's a recipe for chronic exhaustion. You might feel winded climbing stairs, slow during your morning walk, or too tired to enjoy hobbies you once loved. And here's a startling fact. In many liver disease cases, fatigue is the only symptom until the disease has progressed significantly. That's why recognizing it early can literally save your life. So if you, or someone you care for, has noticed a creeping, unexplained sense of tiredness that doesn't get better with rest, don't just write it off. Ask your doctor about your liver. It's better to rule it out now than to discover it later when the damage is far more difficult to reverse. Remember, your liver works 24/7, and when it's in distress, your body will feel the strain everywhere, even in your energy levels. Jaundice. The yellow warning sign that screams trouble. One of the most alarming and visually unmistakable signs that your liver may be in serious danger is jaundice, a yellowing of the skin and the whites of the eyes. While fatigue might creep in slowly and subtly, jaundice tends to grab attention fast, but by the time it shows up, the liver is often already struggling significantly. Jaundice results from an accumulation of bilirubin, a yellowish substance produced during the normal breakdown of red blood cells. Under healthy conditions, the liver processes this bilirubin and excretes it in bile, which then leaves the body through the digestive tract. However, when the liver is damaged, Whether from hepatitis, cirrhosis, fatty liver disease, or even a tumor, it loses its ability to filter out bilirubin effectively, causing it to build up in the blood and eventually deposit in the skin and eyes. That yellow tinge is more than just a discoloration. It's your liver waving a red flag. Seniors are particularly susceptible because liver function naturally declines with age, and many older adults take medications that further stress the liver's detoxification systems. Additionally, age-related dehydration can thicken bile and slow its flow, worsening bilirubin buildup. What's even more concerning is that jaundice can develop quietly and progress before you notice. It may start with a subtle golden hue under the tongue or around the eyes, areas often overlooked until the yellow becomes more pronounced. Sometimes, caregivers or family members notice it before the individual does. It's critical not to dismiss these changes as cosmetic or benign. When jaundice is present, it's often accompanied by other liver-related symptoms such as dark urine, pale stools, or intense itching, each of which signals that the liver is no longer properly filtering waste. The itchiness, known as pruritus, is often relentless and can lead to sleep disturbances and mood changes, severely impacting quality of life. Studies show that even moderate jaundice correlates with elevated liver enzymes and increased mortality in elderly patients, making early detection and diagnosis vital. Moreover, in some cases, jaundice can indicate an acute liver failure episode, which progresses rapidly and can be fatal without emergency intervention. For this reason, any hint of yellowing in the skin or eyes should prompt immediate medical evaluation, especially in seniors. It's worth noting that the presence of jaundice can sometimes be mistaken for other skin conditions, especially if the individual has naturally yellow undertones or is in poor lighting, which is why intentional, regular self-checks or assisted checks for those with impaired vision can be life-saving. In hospitals and clinics, jaundice in seniors is a symptom that demands urgent diagnostic imaging and liver function testing. Doctors will often check for viral hepatitis, alcohol-related damage, bile duct obstruction, or liver tumors. While not all causes of jaundice are deadly, all are serious and require action. The silver lining is that jaundice is a visible, unmistakable marker, something we can't say for many internal conditions. It serves as a critical, external cue that liver function is compromised. For caregivers and seniors alike, it's essential to understand that jaundice is never a normal part of aging. It always signifies an imbalance in the body that must be addressed. Whether it's caused by a blockage, an infection, medication-induced liver injury, or underlying liver disease, the yellow color on the outside mirrors dysfunction on the inside. In many cases, early intervention can halt further damage or even reverse it, especially if the root cause is treated quickly. That's why awareness is so powerful. By knowing what jaundice looks like and understanding what it means, seniors and their loved ones can take timely action that may prevent severe health decline or even save a life. Abdominal pain and swelling, the liver's cry for help. When it comes to liver health, pain and swelling in the abdominal area are some of the more tangible and alarming symptoms that something is going very wrong. Unlike fatigue or yellowing skin, which may be easy to overlook or misattribute to other causes, the feeling of tightness, bloating, or sharp pain in the upper right side of the abdomen often forces people to pay attention. But even then, the true cause is not always recognized. The liver is located just under the right rib cage, and when it becomes inflamed, scarred, or enlarged due to chronic disease or injury, it can press against surrounding tissues and cause discomfort ranging from dull aches to stabbing pain. Many seniors describe this pain as persistent or deep, sometimes worse after eating or when lying on their right side. But what's most dangerous is when abdominal swelling accompanies the discomfort, a condition medically known as ascites. Ascites is a serious accumulation of fluid in the abdominal cavity, and it's a classic sign of advanced liver disease, particularly cirrhosis. It develops when the liver becomes so scarred and dysfunctional that it can no longer maintain proper blood flow and pressure in the veins leading to and from the organ. This increased pressure, combined with impaired protein production, causes fluid to leak into the abdominal space, making the belly appear distended, heavy, and firm to the touch. Seniors with ascites often notice their waistband feeling tight or find that they're gaining weight in the stomach even as the rest of their body thins out. This is not just cosmetic or inconvenient, it's a medical emergency in many cases. Excess fluid can impair breathing, cause discomfort when sitting or sleeping, and even become infected, leading to a life-threatening condition called spontaneous bacterial peritonitis. What's more, abdominal pain and swelling may be misdiagnosed in older adults as indigestion, constipation, or even a bladder issue, especially when they're seen by non-specialists. But liver-related abdominal changes have distinct patterns. For instance, liver-related swelling often comes with visible veins on the abdomen, yellowing of the eyes, or a history of liver strain due to alcohol, fatty diets, or medication use. In some cases, the discomfort is less about pressure and more about liver capsule stretching, which occurs when the liver becomes enlarged due to inflammation or fat infiltration. This stretching pulls on nerve endings and causes a dull pain that radiates to the shoulder or back. It's a type of pain that tends to come and go but becomes more frequent and intense as the disease progresses. Ultrasound and CT scans often reveal the extent of liver enlargement and fluid retention, but these are not routinely ordered unless the symptoms are clearly communicated. That's why education is crucial. When seniors and caregivers know what to look for, they can advocate for testing before things reach a crisis point. Even minor swelling that seems benign could be the early stages of ascites. Coupled with fatigue or jaundice, it paints a very different, and more urgent, picture of liver health. Additionally, liver-related swelling is often accompanied by a loss of appetite and a feeling of early fullness, which leads to further nutritional decline and frailty in seniors. Their abdomen fills with fluid, but their body starves of nutrients, leading to muscle wasting and an increased risk of falls, fractures, and hospitalization. According to research from the National Institute of Diabetes and Digestive and Kidney Diseases, up to 85% of patients with cirrhosis will develop ascites, and the presence of this symptom drastically increases the risk of mortality. Early intervention, including diuretics, low-sodium diets, and sometimes procedures to remove excess fluid, can greatly improve quality of life, but only if the symptoms are caught and treated in time. Unfortunately, many seniors are not aware that their liver is the culprit behind their belly changes, especially if they've never been diagnosed with liver disease before. That's why it's critical to connect the dots between abdominal pain, bloating, and liver function, and to take these signs seriously instead of dismissing them as normal parts of aging. If you or someone you care for begins to experience a bloated belly, pain near the right ribs, or an unexplained increase in abdominal size, it may not just be gas or overeating. It might be your liver's way of crying for help, one you can't afford to ignore. Changes in urine and stool color, hidden signs you can't ignore. One of the most overlooked indicators that your liver may be in serious trouble comes not from how you feel, but from what your body is excreting. Changes in the color of your urine and stool are among the earliest and most telling signs that your liver is no longer functioning properly. Yet they often go unreported because people either feel embarrassed to bring them up or don't understand their significance. Your liver plays a vital role in filtering toxins and producing bile, a digestive fluid essential for breaking down fats and eliminating waste. When the liver is compromised, whether due to fatty liver disease, hepatitis, or cirrhosis, its ability to perform these tasks becomes impaired, and the effects quickly show up in your bodily waste. Healthy urine is typically light yellow, a sign of good hydration and balanced kidney and liver function. But when the liver starts to fail, bilirubin, a yellow pigment that the liver is supposed to filter out, begins to accumulate in the bloodstream and is excreted in the urine instead. This causes the urine to turn a deep amber, orange, or even brownish color, often described as cola-colored. This isn't a minor inconvenience, it's a flashing warning signal that bilirubin is bypassing the liver's filtration process and spilling into places it doesn't belong. The darker your urine becomes, the more advanced the liver dysfunction may be. At the same time, your stools, normally brown due to the presence of bile, may begin to appear pale, clay-colored, or gray. This happens because the bile ducts may be blocked or the liver isn't producing enough bile to give your stool its typical color. In seniors, this can indicate a bile flow obstruction due to gallstones, tumors, or scarring of the bile ducts from chronic inflammation. These color changes are not just cosmetic, they reflect a failure in the very system that removes waste and keeps the bloodstream clean. Left unchecked, this buildup of bile and bilirubin can lead to complications like cholestasis, where bile actually begins to damage the liver from within. When toxins meant to be flushed out linger in the body, they can cause fatigue, confusion, and even damage to the brain, heart, and kidneys. Seniors are particularly at risk because their detox systems are already under strain from years of medication use, slower metabolism, and decreased hydration. In addition to dark urine and light stools, some patients also report foul-smelling waste or changes in consistency, often due to malabsorption of fats when bile production is insufficient. Floating stools, greasy residue in the toilet, or the need to wipe excessively may all indicate fat malabsorption, a direct result of bile deficiency tied to liver dysfunction. What makes this even more insidious is that many seniors attribute these symptoms to dietary issues, dehydration, or aging, rather than connecting them to the liver. Caregivers and healthcare providers must remain vigilant and ask the right questions, especially if these symptoms appear alongside fatigue, jaundice, or abdominal swelling. Routine urinalysis and stool tests can offer valuable clues, and when paired with liver function tests, can help catch liver issues early, sometimes before irreversible damage sets in. It's also critical to understand that certain liver conditions, such as primary biliary cholangitis or drug-induced liver injury, can manifest almost exclusively through these changes before any pain or fatigue is felt. Ignoring these signs or misattributing them to benign causes delays diagnosis and treatment. Early medical attention can help restore liver function, reduce inflammation, and prevent progression to end-stage liver disease. So if your urine has darkened unexpectedly or your stool has turned unusually pale, it's not something to brush off or hide. These changes are your body's way of waving a distress flag, signaling that your internal filtration system is malfunctioning. Being aware of these subtle but significant symptoms and acting on them quickly can lead to earlier diagnosis, better outcomes, and a chance to reverse or manage liver disease before it's too late. Unexplained weight loss and muscle wasting. Liver and metabolism at risk. When the liver begins to deteriorate, one of the more dangerous and often misunderstood symptoms is unexplained weight loss, especially when it occurs alongside visible muscle wasting. For seniors in particular, these changes are often mistakenly viewed as natural signs of aging or even perceived as positive because of the cultural obsession with thinness. But the truth is far more concerning. The liver is central to metabolism, acting as the body's engine room, breaking down nutrients from food, producing proteins, regulating hormones, and storing energy in the form of glycogen. When the liver becomes diseased, whether due to chronic hepatitis, cirrhosis, or fatty liver disease, its metabolic machinery begins to break down. This leads to a state of malnutrition even in those who are eating regularly. In advanced liver disease, a condition known as hypermetabolism can occur, where the body burns calories at a rapid rate due to increased inflammation and stress. This means that even with sufficient caloric intake, the body still loses weight, particularly muscle mass. This process is called sarcopenia, and it's a devastating combination of muscle degradation and malnutrition that leaves seniors physically vulnerable. They may appear thinner, weaker, or frailer, and the effects can progress rapidly. It's not just about aesthetics. Losing muscle mass in the legs and core increases the risk of falls, fractures, and mobility issues. The arms may start to look bony, the temples may hollow, and clothes may hang more loosely even though no effort to diet has been made. Some seniors might notice that rings slip off their fingers or dentures no longer fit correctly due to changes in facial muscle tone. These are all signs that the body is consuming its own muscle to meet energy demands because the liver is no longer processing nutrients effectively. Compounding the issue, liver disease often results in loss of appetite and nausea, which further decreases food intake. The liver also plays a key role in producing albumin, a protein that helps maintain fluid balance and transport hormones, vitamins, and drugs throughout the body. When albumin levels drop, not only does fluid start to accumulate in the abdomen and legs, but the body also begins to lose its ability to retain lean tissue. This leads to the eerie contradiction where a person may look bloated in the stomach while the rest of the body shrinks and weakens. According to the Journal of Cachexia, Sarcopenia, and Muscle, up to 70% of patients with cirrhosis suffer from some form of muscle wasting. This is not a small problem. It's one of the strongest predictors of mortality in liver disease. And yet, because it often happens slowly, many people don't realize what's happening until significant strength has been lost. Everyday activities like getting out of a chair, lifting groceries, or walking upstairs can become exhausting or even impossible. Worse still, some seniors may attribute these issues to arthritis or inactivity, not realizing that their liver is quietly shutting down their body's ability to maintain muscle. Caregivers and family members should be trained to notice the early signs of sarcopenia and advocate for proper nutritional assessments. Medical professionals can confirm liver-related malnutrition through blood tests and imaging, but early observation at home is critical. In many cases, targeted nutritional therapy, including branched-chain amino acids and resistance exercise, can help slow or reverse the muscle loss. The liver's impact on hormone production also plays a role here. As the liver breaks down more slowly, estrogen and cortisol levels can rise abnormally, leading to fat redistribution, loss of muscle tone, and mood disturbances. The end result is a senior who feels and looks dramatically weaker than they did just a few months earlier, and unless liver function is tested, the root cause may remain hidden. Unexplained weight loss and muscle wasting are never harmless signs, especially in older adults. They're silent alarms, flashing a warning that something deep in the body's core systems is no longer working as it should. The earlier this symptom is recognized as a red flag of liver dysfunction, the better the chances are of implementing strategies that can stabilize the body and improve long-term health. Don't ignore it, don't normalize it. Treat it as the urgent health alert it truly is. Skin and nail changes. The liver's warning written on your body. The surface of your body often reveals what's happening deep within it, and when it comes to the liver, your skin and nails can be surprisingly accurate indicators of internal distress. Many seniors might notice subtle changes, dry patches, discoloration, brittle nails, but shrug them off as nothing more than cosmetic concerns or the effects of aging. In reality, these visible transformations can be powerful warning signs that the liver is in trouble. The liver is deeply involved in the regulation of hormones, blood clotting, immune response, and detoxification, all of which have an impact on the health of your skin and nails. When liver function declines, toxins start to build up in the bloodstream, causing the skin to react in various ways. One of the earliest signs is itching, sometimes widespread, sometimes isolated to the palms of the hands and soles of the feet. This itching, known medically as pruritus, is caused by the buildup of bile salts under the skin. Unlike ordinary itching, it doesn't typically involve a rash and often worsens at night, disrupting sleep and significantly reducing quality of life. Seniors may scratch so much that they break the skin, leading to sores, infections, or chronic irritation. At the same time, the skin may begin to develop spider angiomas, small, red, spider-like blood vessels that spread outward from a central point. These are most commonly found on the face, neck, and upper torso and occur because of hormonal imbalances caused by the liver's impaired ability to break down estrogen. Another visual clue is the appearance of palmar erythema, where the palms become unusually red and warm. Though often painless, this condition is a hallmark of liver dysfunction, particularly in older women. Yellowish patches, bruising easily, and a waxy or blotchy skin tone can also signal that the liver is no longer metabolizing waste effectively. Because the liver produces proteins essential for clotting, seniors with liver damage may bruise or bleed more easily, even from minor bumps or scratches. These signs may appear gradually, but they're not harmless. They indicate a progressive decline in liver performance. Nails, too, can offer vital clues. Clubbing of the fingers, where the tips become rounded and the nails curve downward, may develop as oxygen levels drop due to liver-related circulatory problems. The nails themselves may take on a white or opaque appearance, often referred to as Terry's nails, a condition strongly associated with liver cirrhosis. Vertical ridges, increased brittleness, and even spoon-shaped nails can all point to nutrient malabsorption, a direct result of the liver's failure to process vitamins like A, D, E, and K. These deficiencies don't just affect appearance, they impact immunity, bone density, and energy. One of the most overlooked signs in elderly individuals is jaundice in the nails and skin folds, which can be masked by poor lighting or vision impairments. The yellow hue may not be uniform, sometimes presenting as patchy or focused in areas like the sclera of the eyes, behind the knees, or under the fingernails. It's important to recognize that these changes are not isolated. They usually occur in combination with other symptoms like fatigue, swelling, or digestive problems. That's why skin and nail assessments are becoming more common in liver clinics and geriatric health evaluations. The American Association for the Study of Liver Diseases encourages healthcare providers to consider skin signs as part of a full-body liver assessment, especially in seniors with no prior liver diagnosis but who exhibit these subtle indicators. While creams and ointments may provide temporary relief for some skin symptoms, they do not address the root cause. Treating the underlying liver condition, improving bile flow, and restoring nutrient balance is the only way to reverse or halt the progression of these symptoms. Seniors should also be cautious about self-medicating with over-the-counter creams or supplements, as many seemingly harmless products can stress the liver even further. Open conversations with healthcare providers, routine liver panels, and dermatological checkups can all help catch these signs before the liver damage becomes irreversible. Your skin and nails are more than just a reflection in the mirror. They're a coded message from your liver, asking for help. The more attuned we are to these outward expressions of internal decline, the better our chances of protecting liver health, maintaining independence, and aging with strength and clarity.